Never agree immediately. 5 high-risk surgeries for seniors. Many families feel relieved when a doctor finally has a solution in the form of surgery. It often seems like the best and fastest way to recover. However, in older adults, this decision is often the most critical turning point. Because at an advanced age, the biggest challenge is not just the disease, but the body's ability to recover. Why are surgeries more dangerous for seniors? Before discussing the types of surgeries, it's important to understand one key concept: frailty, a condition where an older person's body becomes easily fatigued, weakened muscles, reduced endurance, more vulnerable to physical stress, including surgery. Even procedures that are medically successful can result in loss of function, unable to walk independently, dependence on others, a drastic decline in quality of life. 1. Open heart surgery, bypass. This surgery is often seen as a life-saving procedure for heart disease. Hidden risks: stroke due to disrupted blood flow to the brain, cognitive decline, memory problems after surgery, prolonged ICU stay and cascading complications. Important reality: some patients survive the surgery but never return to their previous condition. Wise considerations: can symptoms still be managed with medication? Do the long-term benefits outweigh the risks? 2. Joint replacement surgery, knee, hip. The goal is to reduce pain and improve mobility, often underestimated risks: infections that are difficult to treat, failed rehabilitation, unwilling or unable to do exercises, increased risk of falls after surgery. Clinical reality: some seniors actually become more limited after the procedure. Realistic alternatives: targeted muscle strengthening, assistive devices, cane, walker. Long-term pain management. First, spine surgery, often promised as a quick solution for chronic back pain. Risks: unsatisfactory results, pain may persist, nerve complications, dependence on medication after surgery. What's rarely discussed: chronic pain often doesn't come from a single source. Safer approach: long-term physical therapy, posture education, multidisciplinary pain management. Aggressive cancer surgery. In older adults, the goals of cancer treatment need careful reconsideration. Major risks: the body may not tolerate major surgery. Recovery can be harder than the disease itself. Significant decline in quality of life. Critical question: are we prolonging life or prolonging suffering? Alternative approaches: less aggressive, targeted therapies, comfort-focused care, palliative care, open discussions with family and doctors. 5. Major abdominal surgery involves vital organs such as the intestines, stomach, or liver. Risks: severe infections, decline in organ function, long-term dependency. Reality: some seniors never regain independent living after major surgery. Alternatives: conservative treatment, close monitoring, lifestyle modifications. The most important part: making the right decision. Before saying yes to surgery, ask these questions. Critical questions: what happens if we don't proceed with surgery? What are the chances of a better life after surgery? How long is the recovery process? Is the patient physically and mentally prepared? The role of family is crucial. In serious medical situations, especially involving older adults, families often find themselves in the most difficult position, having to make fast decisions in the middle of fear, pressure, and the desire to do everything possible. But in reality, the best decisions rarely come from panic. What's truly needed is calmness, understanding, and the courage to think clearly. why the family's role is so important. In many cases, older patients can no longer fully make decisions on their own due to physical or cognitive decline. This is where the family becomes the primary decision maker, the patient's advocate, the guardian of the patient's values and wishes. This means the family is not just there to approve the doctor's plan, but to truly be the voice of the patient. Common mistakes families make. Under pressure or in emergency situations, families often agree to surgery without fully understanding the risks, assume the most aggressive treatment is the best option, feel guilty or afraid of not doing enough, don't take time to ask questions or seek clarity. Yet rushed decisions can have serious consequences, especially for older, more fragile bodies.